Good afternoon, everyone. This is Evelyn Mantilla coming to you from Access Health Connecticut. Thank you for joining us today. We are going to be doing our webinar for this afternoon on Release 27 information and plan review. As I said, my name is Evelyn Mantilla coming from Access Health Connecticut. I'm happy to let you know that we have some great presenters today. First, let me do a little bit of housekeeping. The participants are automatically muted once you are logged in. Please keep your audio muted for the duration of the webinar. We are going to be very happy to have questions come from you. They will be reserved for the end of the webinar. Type any question you may have into your chat box, which is located in the control panel, and the presenters or special guest will answer. Lastly, if you find your audio component experiencing any technical difficulties or you wish to call in instead, please switch from audio to phone call in at the control panel. You will be given a phone number and access code to dial in and listen to the webinar. So I'm happy to let you know that today we are going to hear from three people: Deb Eastman, who is our enrollment manager, as well as Katie Hearn, training and quality assurance manager, and Ann Lopes, carrier product manager. So with that said, let me hand it right over to Deb. Deb, welcome.
Thank you. Good afternoon, everybody. And I just want to say thanks. I know it's a really busy time for everybody. So thanks again for joining us. And today, Katie's going to start off with the Release 27 information, which is all about the HRA. And then also Ann's going to pick up about the plan review and also what's coming next, what to look forward to for 2020. I do ask that a lot of the information, the plan information, may not be pertinent to all of the CACs, and some of it's redundant from the community conference and then also our in-person broker training. So feel free that after you listen to the Release 27 information, if you feel the information has already been covered, feel free to leave the call. And or if you want to stay and have any questions at the end, we'd be happy to answer. But thanks again, everybody.
Great, thank you. Thank you so much, Deb. So now we're going to hear from Katie Hearn, our training and quality assurance manager on Release 27 information. Welcome, Katie.
Thank you.
We will get you to the right slide in just a moment.
Okay. So for those of you who have been assisting with enrollments, you've probably seen a new screen where we're asking consumers if they are offered an HRA by their employer. This is a new screen in HICS. It asks questions that are sort of similar to the employer-sponsored coverage questions in some ways. So employers of any size may offer individual coverage HRAs to employees for individual health plans that could be purchased on or off the exchange. This is a new rule as of January 1st, 2020. Funds are provided by the employer and they're passed along to the employee to help pay for plan premiums for individual coverage. And they may be there to also cover other medical expenses. It's important that customers check with their employers and read the terms of their HRAs so they know exactly what they're being reimbursed for. Employers may offer HRAs or group health plans, but to an individual category of employee, the way I understand it, they can either offer like an employer-sponsored coverage group plan or an HRA. Some businesses may offer both, but I believe that they would be offered to different categories of employees. Employers can offer, yeah, there we go. So next, thank you. So there's no minimum or maximum contribution amount for a health reimbursement arrangement. To satisfy minimum essential coverage requirements for large employers, the amount offered must be enough to make coverage affordable by the ACA definition of affordable. So there's new questions in HICS that ask about self-only HRA reimbursement amounts. And it's important that the consumer fill that amount out correctly so that we can let the application run the affordability test for their health reimbursement arrangement. Employers must provide employees with HRA notice. They get a notice with information about how much they have through their arrangement and who it covers and what their coverage dates are. For plans beginning in January of 2020, exchanges must ask potential QHP enrollees whether their employers have offered them HRAs, and we have to, as I said, run that affordability test. So we have to ask questions about how much they're being reimbursed and how often they're being reimbursed and so forth. Okay, next. If an HRA is offered to an employee and that HRA is considered affordable, an employee is not eligible for premium tax credits. So you cannot get tax credits and be offered an affordable HRA by your employer. So that's very similar to employer-sponsored coverage. If you are offered affordable employer-sponsored coverage, you are not eligible for tax credits either. If an HRA does not make coverage affordable under the ACA definition, employees may be eligible for premium tax credits through Access Health, but they must opt out of the HRA with their employer. So if the HRA is unaffordable by the ACA definition, they can qualify for tax credits with Access Health, but they then also have to go back and opt out of the HRA with their employer. Employee must be enrolled in individual health insurance to access HRA funds, and they have to show proof to their employer of enrollment in a plan. If a plan terminates, they must notify their employer, and HRA funds are no longer available in the future from the date of the plan's termination. So if you have an individual coverage plan and it ends, HRA funds will not be available to the employee after that to reimburse their medical expenses. Employees offered HRAs will be eligible for a special enrollment, if not during open enrollment. So I guess just like on the individual market on or off exchange, if you have certain life events, you would be eligible to enroll on an HRA. An HRA reimburses employees for premium costs after the premiums have been paid to the insurance company. So the employee pays money up front, and then they are reimbursed for those healthcare costs, like their premium amounts. They're reimbursed for paying their premiums.
Okay, terrific. Thank you so much, Katie. Now, I understand that we're going to do the Release 27 information. If you hold on for a second for us, we will get you the correct slides, and then Katie can continue.
Okay, so I will talk a little more about HRAs, and then there's a couple of other new screens that came along with Release 27A, and those are quite short. So I'll talk a little bit more about HRAs and then go over a couple of screen changes that you might be interested in. An individual coverage HRA requires employees and any covered dependents to be enrolled in individual health insurance in order to be covered by and to receive reimbursement for medical expenses from the HRA, which may include premiums and cost sharing for individual health insurance coverage. Someone offered an individual coverage HRA that is affordable, as I said, isn't eligible for advanced premium tax credits or premium tax credits. However, if the individual coverage HRA is not affordable, an employee and any dependents to whom the HRA is offered may opt out of that HRA. 'HRA, 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 ' Employees and their dependents, if applicable, will generally have one chance per year in advance of the first day of their HRA's plan year to opt out of their individual coverage HRA. So it's important to communicate with consumers about when these periods are. They'll have to communicate with their employers if they don't know. We don't know. There's different scenarios. I don't know of a particular time of year or anything that I can point to. This is all very, very new to us too. When someone attests to being offered ESI, the first question that appears is it a health reimbursement arrangement for individual coverage? If the answer is yes, several questions follow. You need to list your employer name, address, EIN or employer identification number, employer contact information, and then there are more questions about the cost or the reimbursement amount rather. Next, please. Unlike traditional ESI, when an HRA is offered, the employee offered the coverage must be on the application and be selected at this screen. Okay, so this is a little tricky. With ESI, if someone outside of the household is being offered employer-sponsored coverage, you need to acknowledge that in the application. However, you don't actually have to add that person to the application. The difference with an HRA is that when an HRA is offered, the employee offered that HRA has to be added to the application. Now, they may not be requesting coverage. They may have an arrangement that covers dependents, but they're still supposed to be added to the application. And so that's a little tricky. It's an extra step, you know. Even if the person offered the HRA is not in the same tax household, they have to be added to the application if offered an HRA by their employer. Additionally, there is no question about if HRA meets minimum value because an HRA, because it's being used to reimburse premium amounts for an individual coverage plan. So there's no question about minimum value for a health reimbursement arrangement. At the bottom of the HRA screen will be text for how to answer this section. The consumer will be asked, similar to employer-sponsored coverage, what is the maximum self-only dollar amount? So instead of what is the premium cost for the employee only, it is what is the maximum self-only dollar amount available to the employee covered by the HRA? And then how frequently are they reimbursed that amount? There's a drop down, yearly, weekly, monthly, etc. So if they don't know the answers to these questions, they do need to go back to their employer or look to their HRA benefit details and find out, you know. Finally, they'll be asked for the start date of the HRA. They should know when their HRA plan began. The ASI screen will provide the household with an early idea of whether the HRA is considered affordable or unaffordable based on the ACA's definition of affordability. The household should always complete an application before assuming to know the eligibility results. If it is deemed unaffordable, the HRA, it's important to tell the applicant that they may be eligible to enroll in a QHP with APTC, but they must opt out. They have more work to do. They have to opt out of their HRA offered by their employer. or they might have to repay their APTCs. An individual denied subsidy due to the HRA being determined affordable will be shown a denial reason on the eligibility determination page. So if you get to the eligibility results page and there's a question as to why someone did not qualify for a QHP with tax credits, this is one of the reasons someone might not qualify for a QHP with tax credits. Okay, and some screen changes and additions. The multi-tiered plans now display a little bit differently. So on the shopping screen tile on the far right, You can see where it says annual deductible, that it's listing the different deductible amounts for the various tiers within the multi-tiered plan. That's just a new kind of detail that you can see at a glance. And finally, there is a hyperlink at the very bottom of the shopping screen with quality ratings. These are CMS quality ratings, star ratings, the QRS star ratings for our qualified health plans. If you're interested in seeing how they rate, you can find that where that arrow is pointing to. It's the very last bullet point at the very bottom of the shopping screen, and it says quality rating information for 2020 QHP products can be found here, and just click where it says here. And that is all I have for release 27I. And I am going to.
Thank you. Thank you, Katie. So now we will set you up with the next slides, and Ann Lopes is going to do the plan review for us. Welcome, Ann. Ann is the Carrier Product Manager here at Access Health Connecticut.
Thank you, Evelyn.
Thank you.
So what we're going to be doing today is just kind of hopefully doing a fairly brief recap of the 2020 changes in the individual market, and also kind of talking about where we're going to be starting very, very soon working on the 2020 plan year requirements for the carriers, and what we expect to be showing on the exchange next year. Next slide, please. We're going to be just focusing on the individual market, but there might be a couple of items that we mentioned going through pertinent to small group. As Deb mentioned earlier, some of this material has been reviewed previously at the in-house broker training as well as at the community conference that was held in October. So the information here in this slide is really just intended to provide a high-level summary of some of the key items pertaining to the 2020 plan offerings. So as you look down the first column, obviously that's just your title for your various rows. The middle column focuses on the individual market, and the right-hand column focuses on small group. We have the same two carriers participating in 2020 that were participating in 2019. The second row gives you basically what the insurance department, the Connecticut Insurance Department, you'll see there, that's the acronym CID, what they made in terms of filing decisions for each of the carriers in those markets. So Anthem, as an example, is showing minus 7.3 to 16.7%. What that means is that some plans had a reduction of 7.3%, and some had as much of an increase as 16.7%. So all the other items just kind of follow through. There will continue to be 17 plans offered through Access Health in the individual market and 14 in the small group market. There are 4 new plans in the individual market, which means since we had the same number of plans for 2019, that means that 4 plans have terminated. So as you look at the next row, the plan crosswalk, 13 of the 2019 plans are renewing. There are 2 silver plans that each carrier offered during 2019 that are not going to be available in the individual market in 2020. That's because Access Health CT changed our requirements with regards to the number of plans that can be submitted by a carrier. And for enrollees that are in any of those terminating plans, those 4 terminating silver plans, anyone that is eligible for auto-enrollment will be automatically mapped to that their existing carrier's remaining silver plan. In the small group market, all of the 14 plans offered in 2019 are renewing. The next row kind of just takes you through some information with regards to cost share changes. So when we looked at each of the different plans to try to get an idea of what changes might be incurred from an enrollee cost sharing perspective, we just bucketed very, very high level. The MOOP, that's the maximum out of pocket. So 11 of the 13 plans had a change in the MOOP. 7 of the plans on the individual side had a change in emergency room copay, et cetera, et cetera, et cetera. A number of the changes that were imposed for 2020 were as a result in some changes in the Connecticut Insurance Department requirements on copay maximums. So there's a lot more flexibility now on copay maximums. In several of our plans, we, as an example, increased the generic drug copay from $5 to $10. So as far as items in the bottom row, things that are, what we call noteworthy, Connecticut Benefits Inc., they are offering 3 plans on exchange this year that include an adult dental preventive benefit. It's preventive only. It's not an essential health benefit and per ACA rules per se, and consequently premium tax credits cannot be applied to that portion of the plan premium. Connecticut has got a new gold plan that they've put on the table for 2020, which is very, very similar in design to one of their terminating silver plans. It allows enrollees to get a $0 PCP copay at a very specific medical center, the Sanitas Medical Center. There's one other item with regards to the off-exchange plans that are offered through Connecticut. They have come up with a silver plan that is actually lower than any of the on-exchange silver plans. And, depending on what county a person is in, that particular plan could be close to 9% less or close to 12% less than the silver plans that are offered through Access Health. And Anthem came up with a gold plan that actually on exchange is less costly than the silver plans that are offered on exchange. So again, these are just trying to point out some potential opportunities or options for enrollees. And looking really quickly on the small group side, just as informational for you all, there's 10 licensed insurance companies in the small group market that filed plans with the Connecticut Insurance Department. 150 of those plans are available only off exchange. Which leaves basically 14 plans that can be sold, that are sold on the shop exchange. This chart here is essentially just trying to illustrate for you all what our current requirements are with regards to the number of permitted, meaning required plans, and also optional plans for carriers in the individual market. So the first column basically shows the different metal levels, and then on the right-hand side, that shows in the darker black font, it actually shows what the different carriers submitted to Access Health this year. The blue box is intended to kind of highlight for you that at the silver metal tier, there were some changes from 2019 going into 2020, and those changes are that instead of permitting or instead of requiring 2 standard silver plans and 1 non-standard silver plan, that requirement was changed where only 1 standardized silver plan is permitted. So all told, we have 17 plans that are submitted between the 2 carriers, as I mentioned earlier. In theory, each of the carriers could submit up to 13 plans, 4 of them being required and 9 of them being non-standard or optional types of plans. So basically the point here is that the carriers don't really take us up on what they could offer through the exchange. Next slide, please. This is a kind of a similar slide to what we just talked about, but it just goes carrier by carrier and shows exactly what was either renewed or terminated at each of the different metal levels. So in the individual market, we have 2 catastrophic plans, 8 bronze plans, 2 silver plans, and 5 gold plans. We mentioned earlier on that first grid that cost sharing changes for some covered services were in most plans. And then we also talked about Anthem. No, we didn't talk about the tiered network. Sorry, we talked about Connecticut offering plans that have a preventive dental benefit, and then Anthem offers a couple of plans where Katie had just talked about the changes in the screen design for those plans where we're trying to call out that someone who enrolls in that plan, they'd want to really pay attention to the differences in cost sharing and the network providers in each of those different tiers, let's just call them, because there's going to be probably a smaller number of providers that are going to be in what they refer to as the tier 1, or what Anthem calls their value tier. So cost sharing is lower for enrollees in that value tier, but again, the network would be something that enrollees would really want to pay attention to, so they know whether they could actually get that lower cost sharing with the doctors and the hospitals and whatever other providers they go to. So again, this slide here was definitely presented at both the broker training and also at the community conference. And what it's just intending to do is really emphasize for you what plans were offered at the silver medal level by both Anthem and Connecticut Benefits, Inc. for 2019. So those in the top part of the graphic, those plans that are shaded in yellow have terminated for 2020. And they've basically, those plans have all been collapsed down to just the one standard plan that's offered by both carriers. So essentially the standard plan design results in almost uniform cost sharing for those plans for the majority of the benefits. There's a few benefits where, you know, as an example, mail order drug may differ amongst the carriers, but in general, the majority of the services that are covered under the plans have uniform cost sharing for those two carriers in a standard plan. What we're doing here on this slide is just provide very, very high level a comparison of where Access Health plans stand compared to the off-exchange plans in terms of rates. So at the bronze medal level in every county, at least 2 of the bronze plans offered through Access Health CT are lower in premium than any of the other 12 bronze plans that were filed for the 2020 plan year in the individual market. And we kind of already talked about in the silver medal level what our requirements were. So the change in the plan design, the change in the number of plans that were offered resulted in a much richer silver plan being available for consumers, and consequently the premium for that plan is higher. Also, for any plans that are offered through the exchange at the silver medal level in the individual market, there's a load in the premium to account for cost sharing reduction plans at the silver medal level, as funding from the federal government is no longer sent to the carriers for those particular plans. So the carriers have to get the money to pay the higher cost sharing on those plans somewhere, so they get it from the higher premium at the silver level. And then the comparing the silver plan on exchange to what they could get off exchange, especially for someone who's not subsidized, they could see as much as a premium savings, depending on the county they're in, almost 9% to almost 12%, which we talked about before. In gold, in every county, there's one gold plan offered through Access Health that's lower in premium than any of the other 6 gold plans that were filed for the 2020 plan year, either on or off exchange. It does happen to be the Anthem tiered plan, so it's just very important, again, like I said earlier, for people to really explore whether the providers that they do have are going to be in that lower cost tier, especially if they're looking at that. It's just, again, it's another item for people to take a look at. Next slide. I'm going to just walk you through a few slides that we pulled from our October 2019 board meeting. These are excerpts of information presented by a actuarial consultant that Access Health CT contracted with to prepare a report on the impact to consumers for changes in the 2020 rate filings. The left-hand side of this particular slide is really just a different way of talking about the information that I previously conveyed. You'll see the 2019 plans at each of the different medal levels on which number of plans were discontinued and which number of plans are new, with the net, again, 2020-17 plans offered through Access Health. On the right-hand side, this is an item that Wakely had reviewed for us, and it had it really was a point in time kind of an analysis. It was based on the information that Wakely had, say, back in September, October, based on the enrollment of the exchange at that particular time. And what they analyzed was, based on the income that was known for those enrollees at that point in time, how would they be impacted overall in terms of rates and net rates after premium tax credits. And the reason they did this particular analysis was because we knew that there would be some people who were in silver plans last year that had a lower premium silver plan available to them, and that would no longer be available. So for those folks, if they took no action, they would see an increase in their premium, more than likely. We had quite a few people, maybe 20,000 or so enrollees, maybe a little bit more, that were enrolled in the Choice Silver Alternative Plan through CBI, which was a fairly low premium price plan. So a lot of those enrollees are now being bumped to a more expensive silver plan, which would result in them, especially if they're not subsidy eligible, seeing an increase. And so as you look across this particular grid, you see the gold, silver, and bronze, and you see the indicator of whether the individual is eligible or not eligible for a subsidy. But the bottom line was here is that because of the changes that we took in the silver plan requirements, only allowing one plan per carrier, and other changes, things like the federal poverty level change, the change in the formula for calculating the tax credits, et cetera, all that was taken into account to try to figure out overall how many people that were in our plan enrollment as of, say, let's just say, I would believe it was September, would see an impact, and how much of that impact, how much would that impact be? So interestingly enough, it ended up being about a 50-50 split. 50% of the population would see about a $75 on average decrease in their net premium after the subsidy, and 50% of the people would see about a $45 increase. Again, most of these people were non-subsidized that were seeing the increase. The next two slides just shows a little bit more detail with the rate information that we talked about when I started this discussion earlier. So we kind of told you about the SIDS rate approvals for each of the carriers, and we kind of showed the range of those approvals. This exhibit here takes it a little to one more step. And the additional step is that for Connecticut, it shows for every single county what the actual rate increase was for the plans that they offered in 2019 going into 2020 were. Connecticut received approval from the insurance department to alter their area factors. So even though on average Connecticut rate increase might have been, let's just say 6% for a particular plan, in some of those counties where that plan is offered, the rate change would actually be, could actually be higher or lower than that 6%. The blue boxes reflect the changes for 2019 for those two plans that were terminated that are being, auto renewed into the Choice Silver Standard plan for CBI, or the Silver PPO Standard Pathway X plan for Anthem. And again, just to kind of call out the Silver CBI Choice Silver Alternative POS plan, that particular plan for people who didn't make a change and were not subsidy eligible, they would see an increase through the auto enrollment process of somewhere between 19.6% if they were in New London County, all the way up to 26.3% if they were in Hartford County. So that's what this is trying to illustrate. And again, it shows that for each of the plans. Let's see here. So the other little note here, again, we talked about the auto enrollment, that those people would be crosswalked. So this is just basically demonstrating that crosswalk. Next slide, please. This is just the other renewing plans. As you can see here, these are all at bronze. So the Passage Bronze Alternative Plan, that had basically a fairly low rate increase. You can see there in Fairfield County, the premium went down by 0.4%. And in Middlesex County, it went up by 4.8%. So again, the range, depending on the county, could differ for the particular enrollees who are enrolled in those plans. Anyone who was in a Passage Bronze plan last year through Access Health CT, that would be the lowest premium bronze plan that they could get either on or off the exchange. Unless they had a catastrophic plan, unless they had eligibility for a catastrophic plan. We haven't included catastrophic here. So again, of course, there's always the opportunity for people who are being auto-enrolled into a plan to go shopping. And again, there are those new gold and new bronze plans offered by each carrier, and although they might be a different price point than what an enrollee is in right now, they may be more suitable in terms of the benefit design. So it's just important to keep that in mind. The next two slides kind of just walk through some of the information that Wakely Consulting presented at our board meeting with regards to a specific consumer. So what this particular scenario outlines is someone who was 44 years old in 2019, turning 45 in 2020, or 2020 as of 1/1/20, and what the impact would be for that person if they were at about 300% of the FPL. So this illustration shows that person being enrolled in the lowest possible premium silver plan in 2019, and then the results of the crosswalk to the remaining silver plan in 2020. So the first panel of numbers just shows basically for someone who is who would not be eligible for any sort of a tax credit. So these would be people that are above 400% of the FPL essentially. It shows what their premium increase would be county by county. The middle panel of numbers shows for the auto-renewed person who is at 300% of the FPL, what their resulting change in net premium would be after the subsidy is applied. So you see there that even though, as an example, someone in Windham County who was not subsidized would have gotten a 21% increase, that same person in Windham County at 300% of the FPL at this age band would have seen a 7% decrease in their net premium cost for that plan. So even though the premium had gone up much higher, this person could potentially benefit extremely well from this particular change because the benefit design was also richer in addition to the net change in the premium. In the Litchfield County row, we kind of circled that last entry, the entry in the last column there, to kind of call out that if someone in Litchfield who was in the lowest cost silver plan in 2019 was auto-renewed into their CBI plan in 2020, they would have the opportunity to actually move to an Anthem plan at some savings after their tax credit for 2020. And interestingly enough, that's the only county that for this scenario that someone would have actually had to take action to move into a lower cost silver plan, because otherwise the silver plan in all the other counties that the person was mapped into would end up being the lowest cost silver plan. And as mentioned earlier, an enrollee can always shop for a different plan. You know, we talked about the potential for a gold plan maybe being more attractive at a lower premium rate for 2020 on exchange, and the options for people to go off exchange as well. This exhibit right here is very similar to what we just talked about, but it just illustrates the Passage Bronze Alternative PCP POS, because that was the lowest cost bronze plan in 2019 in all counties, and it's also the lowest cost bronze plan in all counties in 2020. So this is a little simpler exhibit because in this situation, we would not expect anybody to go shopping for a richer plan unless they felt that the benefits for this particular plan really didn't suit their needs. But the bottom bottom line here is that for someone who is auto-enrolled in this plan before the tax credit, depending on the county they're in, would see somewhere between a 2 and an 8% increase, 2% for New London and 8% for Middlesex. And anyone who is at this 300% of the FPL with this particular age band would have seen a substantial reduction in their net premium in 2020. So as an example, in 2019, for someone living in Fairfield, they would have been paying the $134 after their subsidy. In 2020, they'd be paying $32 after their subsidy. So, yeah. And we'll talk about moving forward for 2021 plan year. So on my team, the plan management team, we are going to be meeting with our Health Plan Benefits and Qualifications Advisory Committee next Wednesday for our kickoff meeting for the 2020 plan year changes. So what we do in our committee meetings is we review all of the plans that were available in 2020. Once CMS releases what they refer to as their actuarial value calculator tool, we'll be able to assess which of the plans that are required to be offered through Access Health, i.e. the standardized plans, we'll be able to assess which one of those required plans has to have a modification in cost sharing in order to be able to continue to comply with the CMS actuarial value compliance rules. So we'll be, again, having a kickoff meeting next Wednesday. The public is welcome to attend these meetings, and they can provide public comment at the beginning of the meetings. People can also submit written comment with regards to things that are happening at the meetings. So we make a lot of very important decisions. This committee makes a lot of important decisions, or I should say recommendations, which are then submitted to our board of directors in April for approval. And this year's, for the 2020 plan year, the major decision that the committee decided upon to recommend to the board was elimination of non-standard plans at the silver level and only permitting one standard silver plan. That was a huge change from 2019, and there was a lot of discussion about that because, again, as you saw in that exhibit that Wakely, that I reviewed, that Wakely presented during our October board meeting, we knew that, you know, based on this decision, that there would be some people that would be kind of getting a rate increase, which was very specific to this change, while as some people would benefit from the net increase after a higher APTC was generated because of this change. So certification requirements don't include only standardized plans. We also talk about the number of plans that we would require or look for the carriers to offer. We have other requirements with regards to things called essential community providers. It's a specific subset of the provider network, which we require carriers to contract with in order to be certified for each year. So this just basically gives you an overview of what we do all year. And again, the committee meetings take place usually December through April, and then we have other activities that our team is involved in throughout the rest of the year. Next. So how do you find out about information about our advisory committees? So as an example, maybe you'd like to find out what would be on the agenda. Well, the way you would find out about it would be by going to our agency website. The URL is listed underneath the picture on the left-hand side of the screen. You'd click on meetings, then you'd click on advisory committees, and then you click on health plan benefits and qualifications, and you get to a list by year of all of the different meetings. Now, I can tell you that our meeting for next week, the agenda has not been posted as yet. It usually is posted a day or so before the meeting, once we get approval from the committee chair on what should be included in it. So, you know, just be on the lookout for this. We also include, after the meeting is held, we include a link to the presentation where you can see what was discussed, and also we show the minutes to those particular meetings. So it's a very, it's intended to be very transparent for the public and for other constituents such as yourselves. And on the next slide, what this shows, and this kind of came up during the broker in-house training back in September, where I had forgotten to mention as a presenter that our standardized plans, after they're approved by the board, they're available to the general public through this website as early as, say, April or May, depending on when the board approval comes through. So how do you find out what those plan designs are? And again, this is just the standard plans. It doesn't have anything to do with non-standard plans that are submitted by the carriers just based on their own, determination on what the market needs. So how do you get there? Again, you go to our agency website, you click on health plan information, and then the little picture of health plan information. You pick the year that you want to look at, and then there would be a list showing things like our standard plan designs, as well as what we refer to as our solicitation, which is essentially a request for carriers to come on to the exchange. So all of our requirements are included in that solicitation. And then we break out the medical from the dental. And that's all I have today.
Thank you, Ann.
Oh, I'm sorry. I do have in the appendix, just as informational for you all. Thank you, Evelyn, for scrolling over to this. So we've got, for each of the different standardized plans, for 2019 versus 2020, we just have an exhibit that just shows the 2019 cost sharing. And again, this isn't every single benefit. It's just some of the more highly utilized benefits, as well as plan features like deductible and out-of-pocket maximum, where we show what the change was from 2019 to 2020. So I'm not going to go through all of these. This is really just informational for you folks. This will be available. I understand this presentation will be available and posted to the website, so you could always review this after the fact.
Terrific. Thank you so much, Ann. Really appreciate that great update. I understand now that we want to give everyone an opportunity to ask any questions. We have not seen any come through the chat box. So I'll take a moment, and if you do have a question, please type it into the chat box on your control panel, and we will be happy to take a stab at it. If there are none yet, let's see. All right, someone says, I'm sorry I missed the first portion. Can someone email me the review? Oh, terrific. No, we will know your email address here, and we'll make sure that we do that. And someone is also asking, are the slides available? Yes, the slides are going to be available. And in fact, the full recording of today's webinar will be posted on our website as well. So you will receive notice of how to be able to do that. Alrighty, if anyone else has any questions, let us know for this moment. And seeing no other questions, let's see. Yeah, seeing no other questions, then I think that we can close today's webinar. Again, on behalf of Access Health Connecticut, a great big thank you to everyone. And thank you for joining us and taking the time to partake in this information. We wish you all a happy holiday season, and we will close today's webinar with that. So thanks again.
Okay. Very good.